It's a great pleasure to welcome to What's Next Dr. Ron Whelan, who is the CEO of Discovery Health. Fantastic to see you, Dr. Whelan. Thank you for joining us. How are you doing?
Absolutely brilliant to be with you, Aki. Thank you for hosting me. Great to be here.
Well, listen, I'm looking forward to our discussion, because if there's one industry and we met at the Smart Healthcare Summit, and Discovery has certainly been at the forefront of innovation. And if there's one sector that's really being disrupted by innovation and technology, it certainly is healthcare. And Discovery has an unrivaled reputation for innovation, including in the healthcare sector. I mean, you guys are really pushing those boundaries. You're keeping tabs of what's happening globally and where the technology is going. And the latest example of this is personal health pathways. Now, I saw this and I was trying to work out exactly what it is. Could you tell us a little bit about personal health pathways and, what does this offering entail?
Absolutely, Aki. I mean, I think the first thing to say is that I firmly believe that we're at a transformative moment in healthcare globally on the back of big data and artificial intelligence. I'm not sure whether you're aware of this, Aki, but Google put out a report about 4 or 5 months ago where they state that 30% of global data comes from healthcare. 30% of the world's data comes from healthcare. It's an enormous amount of data in healthcare. And with the advent of artificial intelligence and sophisticated machine learning that we can run at scale, I think we can really go on a journey towards making healthcare more precise and personalized. And that's exactly what we've done through Discovery Health and through Discovery Health, our medical scheme. Is what we've done is we've created what we call personal health pathways for all of Discovery Health medical schemes, 2.1 million adult members. That means every single adult member of Discovery Health medical scheme has a personal health pathway. And that pathway is entirely unique to every single individual across the scheme. It includes a range of recommended health actions and includes a range of physical activity actions. Each of those actions are time appropriate, they are person appropriate, and they're designed to maximize your health outcomes. So they're designed to make you live longer based on the actual modeling and the causal inference modeling that we've done in the background. In addition to that, in our objective, across Discovery Health, they reduce your long-term healthcare costs. So reducing your long-term healthcare costs is obviously beneficial to members, beneficial to the schemes. To the extent we're able to reduce your long-term healthcare costs, we're able to reduce your contributions across the scheme. And I think we would all agree that lower medical aid premiums is something we would all aspire towards. So alongside improving health outcomes, we're able to reduce healthcare costs over time through these personal health pathways.
That's absolutely amazing. It's like almost, I remember a few years ago, the airline industry, putting sensors in every part of an aeroplane and it predicting when the part might fail, etc. It's almost the same kind of thing in a human body, like predictive analytics. If you know that this is what you're doing with this particular part and this is what could possibly go wrong. It's amazing. We were talking earlier about how AI is just analyzing so much information. That took me by surprise when you said 30% of data today generated is healthcare, stuff, which is, fascinating to me. But could you talk about the AI technology and that robust data set that you use to power personal health pathways? Because I imagine that itself is a very intricate piece of technology and some very fancy, sophisticated algorithms that are analyzing this data.
Yeah, I mean, I think it does start with the data. Okay, as I said to you earlier on, 30% of the world's data now comes from healthcare. And I think what we can see in healthcare data is we are getting more and more data all the time. Particularly through the advances in electronic health records, particularly in the advances of wearable devices, digitization of pathology results, digitization of radiology results. With that data, it's always been a challenge to analyze that data. And, we've had to develop a range of models and algorithms to analyze that data over a period of time. And I think artificial intelligence has accelerated the analysis of that data now. Across Discovery, bearing in mind that Discovery is an international organization. In fact, we have 40 million clients across 40 countries globally. We have an enormous data set. In South Africa alone, we have over 60 million life years of data. Discovery was founded back in 1992 by Adrian Gore and Barry Schwartzberg. And throughout that journey, it's been a data-driven company. And we've accumulated that data over a long period of time, as I say, accumulating into 60 million life years of data. The data set is also a very unique data set in that it includes a range of claims data. So you'll remember, if you're a Discovery Health Medical Scheme member and you go to a general practitioner or to a specialist, or you're admitted to hospital, Discovery Health gets the claims. And that includes your data on that particular event. It includes all of the coding information on that. But in addition to the claims data, what we've also got is a range of lifestyle and wearable data, which is expanding exponentially over time. So smartwatches generate all sorts of data nowadays. So it generates physical activity and movement data, steps data, heart rate variability data. It can measure your sleep patterns. I mean, it's just remarkable what we're seeing in lifestyle and wearable data. So on the back of that, we've got a very, very big data set that we've used extensively over several years to improve health outcomes for Discovery Health Medical Scheme members. What we've now built over the last 18 months or so is a very sophisticated artificial intelligence platform. And what the artificial intelligence platform does is it effectively allows us to analyze both the structured data and the unstructured data. So in that data set, we've got now over 33 terabytes of data. The machine learning models in themselves generate a further 300 to 500 gigabytes of data on a daily basis. And what we've programmed our artificial intelligence system to do is to find the optimal pathways towards better health. And those optimal pathways to better health have to be personalized and individualized. Every single individual has a different pathway towards better health. So that's effectively what we've done, is taken a very big data set, built a very sophisticated artificial intelligence system with the aim of helping members of Discovery Health Medical Scheme live longer, healthier lives.
Wow. I mean, you've blown my mind with those stats and the amount of data that's been generated. And I love the analogy that you used with, with the maps and the digital maps and the potholes and that sort of thing. I just hope that my health records don't emulate the potholes in Joburg, because then I'll be in deep trouble. But, I mean, it's incredible. You've got all this data about me, okay? And this is my personal health pathway that Discovery has got, right? And you've got it for all your members, and so you've got millions of South Africans on there. So how will this help me as a South African? How will this personal health pathway help me to lead a healthier lifestyle and for me to make the right choices? So you've got this data and you're analyzing it all the time. Do you then make recommendations, say, Aki, this is what we recommend you do to change so that you will live longer? Have I got it right?
Absolutely, Aki. I mean, I think the first thing to acknowledge is that healthcare is extraordinarily complicated. It's a complex ecosystem. It's a complex topic, and often not clear exactly what you need to do to improve your health. We know the broad brushstrokes of improving our health, but what I do on a day-to-day basis, a week-to-week basis, a month-to-month basis, how do I track my progress across that? So we've set out on a journey to simplify healthcare for members of the Discovery Healthier Medical Scheme. And as a result, in personal health pathways, while there is a very complex set of data and pathways in the background, what we do is we recommend 3 next best actions on a weekly basis to members. So there are 2 health actions that manifest in the Discovery Health app or the Discovery corporate app. And those are the most appropriate actions for that particular point in time. We call them next best actions. So we simplify it down to a portion of the pathway. Alongside the 2 health actions, then we make a physical activity recommendation around a physical activity goal for the week. Both the health actions and the physical activity actions, I must reiterate, are entirely personalized. So no 2 individuals will have the same health action or the same physical activity action. In addition to that, what we've done is we've made the physical activity actions themselves personalized as well. So every single individual will have a personalized physical activity goal. So if you're someone who's just starting out on a physical activity journey, perhaps you haven't been exercising for a few months or a few years, we'll start you out on an appropriate goal at a lower level and build you up over time. Whereas if you are someone who's been physically active, we may push you, or the machine learning algorithms will push you further than what you thought you might be able to go. So it's a simple set of health actions manifesting in a simple user interface on the Discovery Health app, and entirely personalized to that particular individual's needs at that particular time. And then, as I said before, these actions update and adapt depending on your health status. So if there's a new blood test result that comes into our ecosystem, or if there's a consultation with your doctor that reveals some additional information, that'll be incorporated into the artificial intelligence system and update your pathway accordingly. What's interesting around this, Aki, is just to share some additional data, is across the set of actions available, there are 7 million different potential pathways for any particular individual. So effectively what the system is doing is it's picking out of one of the 7 million particular pathways, optimizing for the best possible outcomes for that individual. And then important to say, Aki, in true discovery fashion, I think we recognize that rewards are a critical lever for driving behavioral change. So on completion of the health actions and the physical activity actions, there are rewards available for members of the Discovery Health medical scheme. So you can accumulate vouchers, you can accumulate Discovery miles in completing these actions, and those rewards in themselves are personalized. What also happens is you can accumulate money into what's called the Discovery Health Medical Scheme Personal Health Fund. So everyone across the Discovery Health Medical Scheme has an ability to accumulate funds into their personal health fund, and then the funds in the personal health fund can be used on a range of healthcare services across the healthcare ecosystem. So powerful, simple set of actions tied to, I think, a very attractive rewards. And then obviously the biggest reward is better health outcomes and a longer, healthier life.
Oh, wow. I mean, it's amazing. This is really, truly groundbreaking stuff. But I'm trying to think of how it will work now as a user. So I'm with Discovery Health. I've got access to the app. I log into the online version. My watch is linked to Discovery, the blood tests that I do, and all the doctors. You got all that stuff. So could you provide us an example of how personal health pathways will work in a real life scenario?
Yeah, absolutely. I mean, these are great questions. Thank you, Aki. It was great to hear that you're a Discovery Health Medical Scheme member. Delighted to be supporting on your healthcare journey. Perhaps let me give you two examples. I'll give you an example of my personal health pathway and my journey around personal health pathway. So as you can see, and sad to say, I'm now a middle-aged guy approaching my 50s. And my personal health pathway at this where I started at the beginning of the year, my first actions was to go for a prostate screen and to do my vitality health check. Now, 50 years old, and I hate to admit it, I hadn't done my prostate screen yet. I recognize that I'm approaching prostate screen terrain, and this was an entirely valid action and a high-value action because all the way from the age of 45 upwards, men have a risk of both prostate cancer and what's called benign prostatic hypertrophy. Unfortunately, a prostate cancer screen is not a manual examination as many men believe it to be. It's a simple blood test called the prostate-specific antigen blood test. And I got this action, made an appointment to see my GP who gave me a lab form, did a simple blood test for a prostate-specific antigen. Fortunately, the levels are entirely normal, and I got a reward for doing my prostate screen. And that put me on a journey towards completing my personal health pathways. I mean, the relief of knowing that you don't have a prostate cancer risk is incredible, and achieving a reward for on the back of that was a delightful moment. Of course, the reward went straight to my wife, who gladly used the Woolworths voucher on my behalf. So that's one example. I then did my vitality or my health check, and in my health check, my health check year on year has been very, very stable. But in January this year, I picked up that my cholesterol was slightly elevated. And I got the reward for completing my health check as part of Personal Health Pathways, because that was my health next best action. But what was really, really interesting around the health check, Aki, and I wanted to point this out, is because my cholesterol was slightly raised, the artificial intelligence system picked up that I had a slightly raised cholesterol, then reprioritized my next best action to say, you need to consider cholesterol medication, have a consultation with your GP around potential cholesterol medication, or have a dietitian consult around your diet. So can you see how quickly the pathway adapted?
Yes.
On additional information that came into the system. Fortunately, I've been able to address my cholesterol through pretty simple lifestyle changes, lower fat content in my diet, higher vegetable content in my diet, and I've brought my cholesterol back in range. This is the way it works. Alongside those health actions, I then had regular physical activity actions, and it's pushing me up the physical activity curve. I'm aiming to improve my VO2 max, which is an indicator of general your ability to exert yourself on a physical activity basis. So that's I guess a simple example for my next best actions. I'll give you another powerful example. We've recently had a member write to us who started her Personal Health Pathways journey in the middle of January this year. She's a Discovery Health Medical Scheme member, downloaded the Discovery Health app. She's mid-50s, and her next best action was to go for a mammogram. I picked up that she hadn't been for a mammogram in the last 10 years or so. She was due for a mammogram. It also picked up some information on a family history of cancer through the database. And she decided, well, there was a reward attached to the mammogram, and she could unlock the reward by completing the mammogram. She could also accumulate 500 Rand into a personal health fund for completing the mammogram, and it was just the right thing to do. Lo and behold, she booked an appointment through a mammogram, through our online booking platform, and they picked up a lump. And that's a frightening thing to pick up. But fortunately, if you catch lumps early and you catch breast cancer early, it's entirely treatable. And she went for a confirmatory biopsy on the lump, and it turned out it was stage 1 breast cancer. Now, the survival rates on stage 1 breast cancer are well over 90%. But if you move into stages 3 and stages 4 breast cancer, the survival rates drop into the 30 and 40% ranges. So through a simple next best action on Personal Health Pathways, going for a mammogram, being rewarded for the mammogram, we're able to detect stage 1 breast cancer, easily remove the lump, well over 90% survival rates. Well, now her next best actions on her pathways will update to monitor her progress over time. So that's the sort of impact we're seeking to achieve. That's a real change in lives and lifespan.
No, I mean, I think that's brilliant. I mean, I many years ago, I did some work with the Prostate Cancer Foundation, because it runs in my family, for example. And, I was with a group of, urologists, and, were telling me the importance of, going for those tests that you just spoke about, especially men over the age of 45. But it's amazing when you talk to guys and your friends around at, the coffee table, and you talk about that sensitive subject. I'm always amazed at how many guys haven't been yet to go and get that, the prostate examination and a simple blood test or the full test. And it's such an important one. And I get now how the system is now almost guiding you as an individual to make the right choices before it gets too late. Rather be safe than sorry, and know what your body is doing. And the breast cancer one is a great example, because more often you're hearing of women that haven't been for a mammogram and they discover it too late. So a brilliant way of doing it. Just out of interest, with your cholesterol that you mentioned, does Personal Health Pathways will it recommend a dietary change? You said you've changed your diet, but will that do it as well? Or is that coming up in the future to say, hey, Aki, your cholesterol's a bit high, low-fat diet, this is what we recommend you change your diet to, include more greens or whatever the case may be. Can it do that?
Yeah, absolutely. I mean, as part of each one of the next best actions, you can click on the tile for additional information, and then it can give you some health recommendations, and that is certainly one of those. So we aim to provide context for why the next best action would have been surfaced, what the potential options are in seeking the appropriate healthcare advice, and then indeed where there's information available on diet and exercise and other things that is made available too. But I think the one thing I did want to point out there, Aki, and your reflections are good reflections. Yeah, as I said, what we've tried to do here is make healthcare much more precise and personalized for members of the Discovery Health medical scheme. And in many respects, what we've done is we've taken off the cognitive load around thinking about your healthcare. So my journey so far is I have no more actions to complete at this stage. So I've completed all of my next best health actions. It's an unbelievable relief, because it says to me, I've done everything. Everything is up to date now. Nothing more to do at this stage. And having nothing more to do is actually a wonderful place to be. Without having that reassurance, you're never sure, well, should I be doing this? Should I be doing that? And you're taking advice from your friends. So having completed all of your next best actions effectively gives you a clean slate and a clean bill of health. And then all you got to do is wait for the next best action. Equally, for those people who are perhaps living with a chronic disease, perhaps it's diabetes or hypertension, it enables regular taking of medication. It enables regular health checks. But once again, just takes the cognitive load off and says, these things are relatively simple to do. You've got a diary and a calendar now through personal health pathways. So we really are seeking to take the complexity out of the healthcare system in a very precise and personalized manner that is both scientifically and data validated in the background. It's important that I point out that everything we do is scientifically and data validated. So these are not actions that we simply program in. There is sophisticated data science and clinical science in the background.
Brilliant. Now, you mentioned the rewards earlier. That always gets me excited. I'm like Pavlov's dog. You reward me, and I'll do I'll do what you want me to do. But rewards are great. It's a human thing. We all love rewards. And Discovery is known for incentivizing clients financially, for making the right decisions. Now, is this present in Personal Health Pathways? And if so, how does it work?
At Discovery, we turn this shared value, and it's been part of the Discovery business model for since the start of Discovery. Shared value is the way we work. And we recognize that in Personal Health Pathways, if members are completing actions, whether they are health actions or physical activity actions, there will be some improvement in health outcomes over time. And sometimes that improvement is in the short term, sometimes that improvement is in the long term. And if there's an improvement in health actions, there's a reduction in healthcare consumption. And if there's a reduction in healthcare consumption, then there's a reduction in healthcare expenditure. And we're able to calculate that reduction in healthcare expenditure in a very precise manner. And on the back of that, we're able to determine what rewards we're able to pay members for completing those health actions. So the rewards themselves are tied to specific reduction in healthcare costs over time. So it's a part of the shared value model that Discovery drives and Discovery Health drives. And we see a significant return on investment in those rewards. Anywhere between
Brilliant.
R2.90 and R3.50 in return on investment in rewards. So it's a significant advantage for the medical scheme. And if we we know that if medical scheme costs are lower, it's to the benefit of all members across the medical scheme, because medical schemes, I don't know whether you're aware, they actually run as mutual or not for profit. So the funds in medical schemes are members' money, and to the extent we're able to reduce your claims costs, it actually results in lower contributions in the following year. So it's shared value in rewards, and it's shared value in longer term reduction in claims costs for the scheme. The rewards, as I said earlier on, manifest in a few different ways. Or you can convert the value of your reward into an immediate voucher across a broad retail network. So a range of different partners, Clicks, Discam, Woolworths, Take-A-Lot, and so on and so forth. Or you can convert your rewards into Discovery Miles. And Discovery Miles is obviously a very powerful currency that allows you to redeem rewards and discounts across a very broad network of partners, including your additional rewards on Discovery D-Day, which happens on the 15th of every month. So a very powerful reward mechanism. And then, of course, as I said earlier on, you can also accumulate money into your personal health fund. And the personal health fund can then be used on a range of healthcare activities. It may be a dental consult. I use my personal health fund to fund my dental checks on an annual basis for myself, my kids, and my wife. You can use your personal health fund for pharmacy co-payments or pharmacy purchases. You can use a personal health fund for GP consults. So it's an entirely flexible mechanism in using that personal health fund. So completing your personal health pathway actions can result in retail rewards, can also result in accumulation of monies into your personal health fund.
So there's lots of different options. What's been the uptake so far? How much interest have you seen in the personal health pathway so far?
I mean, the uptake's been tremendous. We have just short of 170,000 Discovery Health Medical Scheme members activated on personal health pathways. We have just short of a 50% physical activity completion rate, which is remarkable. It means 1 in 2 members are completing their physical activity goals on a weekly basis. We have close on 20% of members now regularly completing their health actions, putting them onto pathways, and both of those metrics are growing significantly over time. We've more than doubled the usage on the Discovery Health app. So people engaging in the Discovery Health app and their personal health pathways and tracking their progress. So we're delighted with the initial uptake of personal health pathways. We're starting to see the energy and momentum build across the Discovery Health medical scheme base. And most importantly, Aki, I'm just delighted with the health outcome improvements. A story like the lady who detected early breast cancer. So that's the real impact. And people picking up prostate problems earlier on. And then we're able to get people onto healthcare journeys and pathways that cures those diseases quickly. And that's exactly where we want to be.
No, it'll be interesting to quantify all of this in the decade from now. I mean, you're already quantifying it by discovering what you've just talked about. But I guess long term, when more people are using this and, the less, costs come down significantly, that'll be fascinating. Anybody watching this and saying, listen, I'm a Discovery member. I need to get started on my personal health pathway. How do they do it?
I mean, it's really easy. So it's accessible through the Discovery Health app. The Discovery Health app is downloadable on the Apple Store. It's downloadable on Google Play. We also have a web-based version called the Progressive Web app. If you don't want to download the full version of the app, there are links available through the Discovery website. And then, watch out for a communication from Discovery Health in this regard. So we've sent out email communication to members. We've sent out WhatsApp communication to members to encourage activation and participation. Also important to note, Aki, and I get asked this question a lot, is that Personal Health Pathways is accessible to all adult members of the Discovery Health Medical Scheme. So if you're an adult member of the scheme, it's available to you. You don't have to be a Vitality member to access Personal Health Pathways. So it includes those people who have Vitality membership as well as those people who don't have Vitality membership. Of course, if you have Vitality membership, you get your outsized rewards and your boosted rewards and a range of other benefits through the Vitality ecosystem. But if you don't have Vitality, you still have access to the Personal Health Pathway rewards. You still have access to the Personal Health Fund. So very, very accessible to members of Discovery Health Medical Scheme. And then we'll gradually build out modules for kids over time. So we haven't yet built the artificial intelligence for kids, but that is part of our development plan. So then it'll be available to, there are close on over 600,000 children are also members of the Discovery Health Medical Scheme, and we'd like to make this accessible to them as well and get them on appropriate healthcare journeys early in their lives.
Absolutely fascinating. Dr. Ron Whelan, the CEO of Discovery Health, sharing us some fascinating insights on the work they're doing with Personal Health Pathways, incredible innovation, and the data and how it's being used with some very smart algorithms, ultimately to reduce costs. But the best part of it is to make us all a lot healthier. Dr. Ron Whelan, thank you very, very much for your time and sharing those insights with us.
Thanks for having me, Aki, and good luck with your personal health pathway. I'm sure we're going to be able to help you live a longer, healthier life, and we're certainly here to partner you on that journey. And let us know how it goes. Good luck.
I will.